My name is Laura Foerster, and I'd like to share with you some thoughts regarding nursing education. People ask me why at this age and stage of my life I've decided to pursue my master's in nursing education. And my response is twofold. The first is that I'm a lifelong learner. I think as nurses and as professionals we have an obligation to maintain that lifelong learning, so that we can then pass our accumulated wisdom and knowledge on to those that are following in our shoes. The second reason I've opted to pursue my master's in nursing education is because I believe there is a dearth of education for nursing students and nurses regarding the legal aspects of nursing and health care. I think back to my own days as in my original associate degree program, and some of the information my instructors imparted was just flat out wrong. So that I would like to be able to dovetail both my nursing and my law degree in education and experience with nursing and implement changes within the nursing practice so the nurses aren't so scared about the regulatory environment in which they practice, and certainly begin to see attorneys as friends and helpers and fellow caregivers rather than the enemy. How do I hope to accomplish this? As I've gone through my educational program through McKendree University, I've come to appreciate the work of Lev Vygotsky, a Russian theorist who believed that learning takes place within the context of one's culture. And within that culture, certain people model behavior that the child or the adult then mirror or mimic and incorporate and assimilate into their own behavior. My only issue with Vygotsky is that he focused first on kids. And there's a dearth of literature to support use of Vygotsky's theory in nursing education. However, I was able to find a couple of other articles in which Vygotsky was used in an undergraduate program to increase and promote learning of various concepts for nursing students. One of the concepts that is key to Vygotsky is the scaffolding of student experiences. And I think of scaffolding as the building and construction of the brain and filling the brain with the information in a student-based environment so that the instructor helps with filling in that scaffolding that's occurring in the student's brain. Means by which this can be done are the pre- and post-conferences prior to clinical assignments or after. Also the modeling of good behavior by not only the clinical nurse educator, but also the staff nurses who a lot of times have students that are assigned to them or work with them as part of their clinical rotations. In order to effectively help fill in the scaffolding in the students' minds and brains, I think it's important to realize that we as instructors have an obligation to model that behavior that we want to see. One of the behaviors I think nursing education is criticized for and as having lacking is that of caring. So for that reason, I am particularly drawn to the work of Nell Noddings. Dr. Noddings started out life as a math teacher out on the East Coast and pursued her master's in education out east and then relocated to the West Coast and achieved her EDD through Stanford University. I might also note that she was the mother of 9 children, so my hat goes off to her for being able to accomplish everything she did, plus motherhood. I just am stymied as to how she accomplished all of that. Dr. Noddings in her writings talks about caring and the need to teach caring as a moral value, not only to our children in the elementary and high school years, but also in colleges, and looking at how we do that. One of Dr. Noddings' beliefs, much like Vygotsky's, is that we need to model that caring behavior. For caring behavior to exist, we need to understand that it is relational. And that relationship is between those who are providing care, in our case nurses or nursing students, and those who are the recipients of care, the patients in our case. It's important in Dr. Noddings' mind that there be an acknowledgement that care is being provided and care is being received. While some patients may not appreciate what we as nurses are trying to do, nonetheless, I think it's an important concept that I, as a nursing educator, can model. I also subscribe to the Buddhist theory that caring is what this life is all about, caring and kindness. And until we model caring and kindness amongst each other and model it for our students, the old adage of nursing eating their young will continue to exist unabated. Thanks so much for this opportunity. I really appreciate it and look forward to getting to know you better.